There is no dearth of information on internet and social media regarding body reshaping or body contouring procedures, and one such common procedure is tummy tuck or abdominoplasty. However, on consultation with our patients, we found many misconceptions about this procedure, and as experts, we felt the need to educate all those people who are considering tummy tuck. Hello friends, I am Dr. Diksha Dixit, Cosmetic Plastic Surgeon, Director and Co-founder of the Aesculip Clinic at New Delhi. And in today's video, I will walk you through step by step on each phase of tummy tuck so that by the end of this video, you are mentally and physically prepared for this procedure. Let us start by understanding three basic things about tummy tuck procedure. 1. It is not a weight loss surgery. Our aim is to contour your body and to give you a flat abdomen and a most functional looking body. Second, it is a proper surgical procedure. So you have to get admitted for the same and you have to be under the supervision of your expert for a day or two. So plan your surgery accordingly and plan your work schedule accordingly. The third thing is that it is not done only for cosmetic reasons or aesthetic reasons. There are a lot of advantages of tummy tuck which are functional as well. Like there are females who present with us as stress incontinence because of heavy abdomen. They are really benefited from tummy tuck. Patients who have severe bloating because of bulging abdomen, they are also benefited. And along with that, the skin rashes or the infections which develop in the skin fold are also eliminated. Along with that, there is also seen an increase in stamina and increased exercise potential in these patients following tummy tuck, and also more compliance with diet and healthy lifestyle after the procedure. Then comes what are the important considerations before surgery. So I will divide these considerations from patient point of view and for a surgeon or an expert. For patients, we need to know your detailed history in terms of your smoking history, any kind of medications like oral contraceptive pills, any herbal supplements you are taking, any kind of drugs you are taking, especially thyroid or sugar medicines you are taking, or you are on blood thinners. Apart from that, any associated medical history or comorbid conditions which may affect our surgery should also be known, along with any kind of allergies. If you have any of these conditions or you are using any kind of medication specified, we need to stop your medications, especially blood thinners, OCPs and any herbal supplements which may interfere with healing, because in healing also as well as in surgery also, because they increase the risk of bleeding. So they have to be stopped 2 weeks before surgery and has to be discontinued even 2 weeks after surgery for a minimum. Along with that, if you are a smoker, you need to stop smoking 2 weeks before and 2 weeks after your surgery for the least, because smoking interferes with healing and you might have problems with healing if you don't stop it. From a surgeon's perspective, we need to know your detailed history. We need to examine you in person before surgery, that is very important, and we need to have a detailed discussion with the patients, know the expectations of the patient and tell them what desired results we can give you after a detailed examination. These things are very important. During our examination, we see patient's profile, we see patient's body shape, we examine the skin quality, the skin tone of the patient, the muscle strength of the patient, the abdominal underlying muscles if they are weak, any kind of herniations because of muscle weakness, the stretch marks, any previous surgeries done on abdomen or a surgical mark has also to be taken into consideration. Along with that, what are your expectations? All these things combine and help the surgeon formulate a plan for you as to whether you require any additional procedure along with tummy tuck like liposuction or fat grafting in certain areas to give you your desired result. What you should expect out of this surgery? This surgery is usually done under general anesthesia. It usually takes 4 to 5 hours to complete a tummy tuck. Additional hours may take if additional procedures are planned like liposuction and fat grafting. You need to be admitted for the same for a day, 2 or maybe more depending on how your recovery is. And you need to have one attendant so as to supervise you and help you through your post-procedure days. What you should expect post-surgery? Usually we tell the patients that there might be swelling, bruising, and your end result will take some time to come. During this period, we need to evaluate you for your decreasing trend of swelling, bruising, any pain, any collection which might happen. You are usually comfortable to join back your work within a week, but it solely depends how you fare after the surgery. To make your post-op recovery smoother, it is advisable that you have an attendant along with you to make your daily routines comfortable. Post-surgeries, you are not to take bed rest. A strict bed rest is not mandatory. You should be moving around so that your blood circulation in the legs move, and it helps in your faster recovery and decrease in swelling. Along with that, the special instructions about pressure garments which you are meant to wear for at least 6 weeks after surgery is mandatory, and I hope you all follow that compliance, which is a must for a quick recovery and a long-lasting result. Before I end, I need to stress upon 2 important things which should be done post-surgery. One is the compliance of the patient, and second is strict post-op follow-up with your experts. Compliance in terms of wearing religiously your pressure garments which help reduce your swelling, your bruising, and also your pain, and decrease any kind of collection which might happen once you start moving around. Along with that, the surgeon may also tell you to massage your area to quicken your recovery process. So compliance is a must from the patient's side to get an expectant result. Compliance in terms of your diet and healthy lifestyle is also important, and how you are going about with your exercise regime in a graded manner. The second most important thing is your regular post-op follow-up visit with your consultant or your expert. During this visit, the expert or the plastic surgeon evaluates you for your swelling, for bruising, your pain, any kind of collection which might happen when you start using your muscles or you start doing your regular activities. Apart from this, the surgeon also evaluates how your healing process is going and also watches for any kind of signs which need urgent attention. During this time, in post-op follow-up visits, the surgeon also tells you how to follow your exercise regime in a graded manner, which is very important for your muscle recovery as well. The usual protocol which we follow is that we call the patient 1 week or 10 days post-surgery, followed by a monthly visit for 3 months, and then thereafter 2 to 3 monthly for a year. These 2 considerations are very important for a long-term success of your surgery. You have invested your time, energy and money in this procedure, so it is equally important to have a good result. Your synchronization with your surgeon is very important for this long-term effective successful results. So please have a post-op follow-up visit with your experts so that they can guide you at each step of your tummy tuck procedure. If you have any further queries regarding this tummy tuck procedure or anything you want to know in details or anything you want for us to make a video on any aesthetic surgery procedure, please do feel free to write to us. You can contact us on the given numbers as well, and we will be very happy to solve all your queries. You can also follow us on Instagram by the name of _Aesculip, and can also follow our YouTube videos for any further updates. We will be very happy to help you regarding any queries. Thank you.